Mr. President. Mr. President, a number of my colleagues have been down on the floor today talking about probably the biggest issue that the Congress will deal with this year and arguably for many years, either past or in the future, and that is the issue of health care reform. We know that issue is now staring us squarely in the face. The various committees that have jurisdiction over that issue here in the Congress have acted, 3 in the House, now 2 in the Senate. It's expected that the Senate Finance Committee will produce a bill sometime later this week. And I think it is a critical debate for the United States Senate, for the American people, because it does represent literally 1/6 of the American economy. What we are talking about is 1/6 of our entire GDP today consists of spending on health care. And that would be government health care, privately delivered health care, but health care nonetheless. And the question, I guess, before the Senate in the next week or two, and this eventually reaches the floor, is what are we going to do here to try and address the fundamental problem that I think most people perceive with our health care system today, and that is that it costs too much. Now, arguably, there are lots of Americans who don't have access to health insurance, and all of us want to see that issue addressed, and that those Americans who currently don't have health insurance have a way of being able to access that health care coverage. Many today use emergency services. It isn't that people are going without health care, but they don't have coverage. And we need to have people in this country to have the assurance and the confidence that they're going to have some sort of insurance that would protect them against those types of life-threatening illnesses and just day-to-day illnesses that afflict people across this country. And yet, the big issue, I think, is the issue of cost for most Americans, and that, as I said before, when you look at double-digit increases for small businesses, for families, it really does affect all Americans in one way, form, or another. It's a very personal issue. Healthcare is personal to people for obvious reasons, but it's also an issue that affects their pocketbooks in a very real and tangible way. And that's why I think there is so much attention being focused on this and so much concern about the direction in which Congress intends to proceed. And I think one of the issues that bears heavily upon that debate is the whole fiscal situation in which we find ourselves. I think that this, if we were having this debate at another time, perhaps the circumstances being somewhat different, you might come to different conclusions. But I think one thing that we all have to keep in mind as we look at how do we address this issue of health care in this country is doing it in a way that is fiscally responsible. And the reason for that is that we see deficits, huge deficits as far as the eye can see. The fiscal year that we just concluded, September 30th, $1.6 trillion annual deficit. Next year is expected to be $1.5 trillion, trillions and trillions and trillions of new spending each and every year. Now, this last fiscal year that I mentioned, the deficit being $1.6 trillion, that literally represents 43 cents out of every dollar that the federal government spent. So 43 cents out of every single dollar that the federal government spent this last year was borrowed. It's all debt. Now, to put that into perspective that I think most Americans can perhaps understand.
Senator's side on the Republican side has expired. I
would ask unanimous consent to proceed, Mr. President, until such time as the other side comes and claims some time.
Is there objection? Hearing none, Senator's right.
Mr. President, the point I want to make simply is this. If you were to put that into perspective for an average American family, if you're an average American family, and let's say that your annual income is $62,000, from all your hard work and labor over the course of a year, you generate $62,000 for your household. That would be the equivalent of spending $108,000. What the federal government is doing by borrowing 43 cents out of every dollar that it spends is the equivalent to a family, a household in this country, making $62,000, spending $108,000. Now, what family in America can do that? What small business in America can do that? Can continue to borrow like that? They can't. It's fundamentally, you cannot do that. And the federal government does it, and we continue to borrow from the Chinese, and we say we'll pay the bills at a later date. But one thing that most Americans understand is, one, you can't spend money you don't have, and two, when you borrow money, it does have to be paid back. And what we're looking at right now is deficits and debt mounting to the point that 10 years from today, the amount that every household will owe in this country is $188,000. Now, how would you like to be a young couple just getting married, just exchange your marriage vows, and knowing that when you start out your life as a family, that you are going to get a wedding gift from the federal government to the tune of $188,000 IOU. That is, in effect, what we are doing to the next generation of Americans. And so that's the backdrop against which this whole health care debate gets underway. We have deficits and debt that's piling up to the tune of $188,000 per household at the end of the year 2019. And so we ought to be looking at how do we, one, solve the health care crisis in a fiscally responsible way that doesn't spend trillions and trillions of more dollars and raise taxes and borrow more and more money. Those are all issues that I think need to be very carefully considered by all members of the United States Senate as we make these important votes. The other thing the point I'll make is this. There are in the proposals that have been put forward, in all of them, tax increases to pay for this. Now, the most recent version of this, the Finance Committee bill, is a $1.7 trillion cost over a 10-year period. And that's the least expensive, I might add, of all the bills that have been produced so far. There are 5 bills that have been produced by the Congress. The Finance Committee bill, to their credit, is at least the least costly of those, $1.7 trillion over 10 years. That's still $1.7 trillion in new spending. Now, bear in mind that we already have a Medicare system which is destined for bankruptcy in the year 2017. We've got all kinds of other long-term liabilities in Social Security and Medicaid and entitlement programs that pile up and pile up and pile up. We're going to have to do something about those at some point. And yet here we are talking about adding an almost $2 trillion new entitlement on top of that crumbling foundation. I think most Americans would take issue with elected leaders that would do that would take a program that literally is on the verge of bankruptcy and try and add another $2 trillion program on top of it. And so there's the overall cost of it to the taxpayers, but it's also how it's paid for. Now, obviously, it has to be paid for somehow, or we deal with this issue of borrowing, which I mentioned earlier. And so what's being proposed is a series of tax increases and a series of reductions, cuts in Medicare programs. Now, the Medicare cuts are going to be bad enough, and Medicare Advantage takes a big whack, which will affect a lot of seniors across this country. The providers are going to take a whack, hospitals, home health agencies, hospices, all those sorts of things. But you've also got about $400 billion in tax increases embedded into the latest version of this proposal, much higher than that in some of the other bills that are currently moving through the House. But nevertheless, the American public is going to be handed a bill for this. That's going to lead to, inevitably, higher taxes. And so much so that the Joint Committee on Taxation and the Congressional Budget Office have estimated that 71% of the penalty will hit people earning less than $250,000 a year. Now, that conflicts and contradicts directly commitments the President made about not raising taxes on people making less than $250,000 a year. And they've also gone so far as to say that the taxes that would be imposed, and there are a series of taxes, as I said, insurance companies would be hit with taxes. The Congressional Budget Office has said those taxes would be passed on dollar for dollar to people across this country. So the insurance companies, yes, they may remit the taxes, but they're going to pass the cost of that on. And so you're going to see not only higher taxes on the insurance companies that get passed on in the form of higher premiums to individuals in this country, and so in other words, you're going to have higher insurance costs, but you've also got taxes put in here that hit people who don't have health insurance. And those taxes get up to be about $1,500 a year for people who don't have insurance. And so people would be penalized, and that would apply, again, across all spectrums of earners, wage earners in this country. But the CBO, as I said earlier, estimated that 71% of that penalty is going to fall on people who earn less than $250,000 a year. And if you project on further, and this again is the Congressional Budget Office and the Joint Committee on Taxation have said that by the year 2019, 89% of the taxes will be paid by taxpayers earning less than $200,000 a year. So that huge tax burden, that $400 billion initially, and that will grow with bills fully implemented, will fall disproportionately on people making less than $200,000 a year. 90%, 89% of those taxes paid by taxpayers earning less than $200,000 a year. And so enormous amounts of new taxation contemplated in these bills, in addition to the Medicare cuts that are proposed to pay for and finance these changes into health care that are being passed off as health care reform. And so I guess my view on this, Mr. President, is that, one, we ought to have the American people need to know these facts. And I think that what that would suggest is that there ought to be ample amount of time when we finally do have a bill. And I know that the Finance Committee is marking up their version of it. They expect to report it out sometime later this week. But what we're going to see reported out is concepts, generalities. We don't have a bill, legislative language, to react to yet. That's going to be put together with the bill that was produced by the Health, Education, Labor, and Pensions Committee earlier, and so those will be merged together. At some point, that will be reduced to legislative language. When it is, we expect it's going to be in excess of 1,000 pages. And so we are now, I think, talking conservatively about having a bill on the floor, not next week, but the week after, which will be fully longer than 1,000 pages, none of which any member of the Senate has yet seen. And the American people, the people who are going to be most impacted by this, will not have had an opportunity to be engaged in this debate or to have their voices heard. And so we need to make sure that we, at a minimum, slow this process down so that we take it step by step, so that we're not rushing to do something very quickly and hurriedly that would be a big mistake for the American people. And so I would suggest that, at a minimum, we ought to have a very transparent, open process, that when we have a bill, if it's in excess of 1,000 pages, that we have plenty of time, not only for members of the United States Senate to review it and to read it and to understand it, but also for the American people to have that same opportunity. And there were amendments that were offered in the Senate Finance Committee that would allow a 72-hour period. That seems to be reasonable. That's 3 days. 3 days to look at something in excess of 1,000 pages, and yet that was voted down. My Republican colleagues on the committee offered that amendment. It was voted down by the Democrat majority on the committee. But 72 hours at a minimum. I mean, I think I can't imagine that you could contemplate and fully grasp and understand that amount, that volume of information in that kind of a bill in 72 hours to start with. But at a minimum, that should have been passed. That amendment was defeated at the Senate Finance Committee, as were a number of other amendments that were offered by my colleagues on the Republican side. But, so having said that, I think first off, we ought to have ample amount of time to review this. Secondly, I would argue in terms of the process itself that rather than throwing overboard and away what is a very, it's flawed. We have a flawed health care system in this country. It's not perfect, okay? It has its problems. We all acknowledge that. We can fix those problems, but we shouldn't throw everything that's good about it overboard. And what this will do is create all kinds of new government involvement, government intervention in the decisions that pertain to health care. Now government's going to dictate what types of insurance plans, or what should be an insurance plan, that in order to be in compliance with this bill, you would have to be able to put forward. And so people are going to have less and less choice, less and less freedom. Government's going to have more and more say, more and more control, more and more decision making. And I think most people across this country find that to be very threatening. I think they are genuinely, honestly concerned about having the government have more and more influence on 1/6 of the economy on an issue that is so personal to them as their health care. So at a minimum, they ought to have an opportunity to review the bill. Secondly, we ought to take this thing and do it step by step and not throw it all overboard, not take what's good about the American health care system and throw it in the ditch simply because it has some flaws that need to be fixed. Those issues can be addressed. We need to cover those who don't have coverage. We need to try and address the issue of cost, but these bills don't do that. We haven't seen a bill yet of the 5 that are being worked on here in Congress that, one, reduces health care costs. They all bend the cost curve up. You ask the Congressional Budget Office, and they all will tell, in every circumstance, they will tell you this does not reduce or drive down health care costs. It actually increases health care costs for most Americans. Secondly, we haven't had a bill yet that actually is what I wouldn't characterize as a budget buster. All these bills are several $1 trillion, as I said earlier, on top of programs that are already destined for bankruptcy in the very near future. And so let's start slow. Let's take this step by step. Let's do this in a way that allows the American people to be engaged in this debate. It does affect them and their livelihoods in a very personal way. It does affect their pocketbooks. It will raise their taxes. And it will also, again, not my words, Congressional Budget Office, lead to higher health care costs, not lower health care costs, which at the end of the day, wasn't that the whole purpose of this exercise in the first place? And so we are going to do everything we can on our side to open this and allow the American people to see it. to give ample time for them to be engaged, and secondly, to make sure that, that when health care reform is done here by Congress, that it is done in a way that is consistent with what I think most Americans believe should be done, and that is reducing and driving down health care costs, not increasing premiums like these bills do, not spending trillions of dollars of their tax dollars and piling on additional entitlement programs on programs that are already going out of business here in the next few years, but in a way that is fiscally responsible. I think that's the least the American people expect of us, and I think that we ought to deliver on that. We ought to deliver on health care reform, but reform that truly accomplishes those important goals.